So we will start. Do we have Tim Bertling?
Might have to say it again. I think you were muted. There.
Which is?
Mr. Chairman.
The red is on?
The red.
You're good.
Green is on.
That's what I thought. Okay. Tim Bertling, do we have you? Glenn Bailey, do we have you? Well, we have a quorum. We will proceed. And maybe those gentlemen will join us at some point in time. We'll stand and have our pledge of allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. You may be seated. One addition to your agenda, down at item number 9, where there is A, B, C, and D. All right, it won't be item E.
It will be item E, but it's under number 8, not number 9. Oh, maybe you have it.
Oh, boy.
Yeah.
All right, we'll have it under item number 9 then. I have two different copies here. But item number E, under letter E under number 8, there will be an added report. Don will tell us a little about his visit to St. Mary's. All right. With that, we will continue on. The first thing on our agenda next is the public comment session. Is there anyone here who wishes to make public comment? You are allowed 3 minutes. Second call, public comment. Third call, public comment, and hearing no one wishing to take advantage of this, we will close the public comment session and move on. Item number 4, the consent agenda. We have the minutes from our December 8 meeting. And then there's a contract. This first contract, I think, is a $39,000 contract. Any questions on that or any comments to be made? All right. Opioid settlement. Any comments, questions? And the policy 1 through 18. If someone called out an emergency and you are sitting right here, which direction would you go to exit the building in the most? Just checking. I mean, we are living in a day and age when knowing this material is more important than it's ever been in my lifetime. So I behoove you to take a glance at that one policy. It's a little bit of an expansion of the old fire drill when we were in grade school. All right. Any other comments or questions on the consent agenda? If not, I would entertain a motion to approve the consent agenda as presented in your packet.
I move to approve a consent agenda as presented.
Thank you, Dr. McClandris. A second?
I will second that.
All right, we have a motion and a second. All in favor of approving the consent agenda indicate by saying aye.
Aye.
And opposed, no. All right, thank you. We have approved that. Moving on to item number 5. Got to make sure I look at the right. There's the copy. Okay. And first, we all know Kim, and Kim is here today to make an introduction of our guest. Kim, you have the floor.
Thank you, Mr. Okay, so today you're going to hear about connecting community to care. This is meeting our objective to increase access to care, which is identified in our Community Health Improvement Plan from 2018. So we will hear from Tegan Moore and how she is accomplishing this in her role as the Psychosocial Rehabilitation Specialist, or a PSR as we call it. She is on our substance use disorder team, and this position is brand new to the health district, and it's made possible by our opioid implementation and family planning funds. So Tegan filled this position at the end of May, and she comes to us with a bachelor's in psychology, very different, and chemistry. She previously worked as a qualified intellectual disabilities professional and case manager for adults with developmental disabilities, which included in-home behavioral management and connecting individuals to care. So with that, Tegan, will you please come up?
Okay, while she is going to the speaker's podium, we want to welcome Tim. Are you with us? Hello, Tim, we see you. Okay, we see you, but we don't hear you, but welcome. All right, you may proceed, ma'am.
Thank you,
You
Mr.
have the
Chairman, Board, and Kim for my introduction. It's good to be with you all. Today I'm going to be sharing how my position has addressed our community health assessment priority area of increasing access to care through referring patients into local social services and building relationships with direct care providers. Is there a present mode or not?
Robert, you're gonna have to assist
I'll forget that.
in sharing. I can scroll through.
That's fine.
With the mouse, please.
Thank you. My name is Tegan Moore. I am the Psychosocial Rehabilitation Specialist here at Panhandle Health District. As Kim stated, I am the first in my position and was hired back in May 2022 to ensure Panhandle Health District could increase access to care in our community. When the position opened for PSR, I was excited for the opportunity to work with our community partners and broaden my ability to assist people in getting them the services that they need. As a psychosocial rehabilitation specialist, I play a few different roles. Idaho Law Enforcement Diversion, otherwise known as IRED, is a statewide initiative created to assist individuals with substance use disorder and connect them to treatment services that will aid in their recovery. Panhandle Health District has partnered with local law enforcement, Department of Health and Welfare, treatment providers, and prosecuting attorneys in Region 1. During a traffic stop, if law enforcement determines that a candidate is eligible for ILED, they may refer them into the program. The client must get a hold of me within 48 hours and schedule an intake appointment. During the intake appointment, I review everything the client may need to succeed, whether that be housing, a job, insurance, healthcare, mental health resources, and of course, treatment. After the intake, once referred to treatment, the treatment provider must see them within a short period of time and establish care. The client has to continue to check in with me weekly, participate in treatment and their requirements, complete a chapter of their addictions workbook once a month, and actively participate in peer support for 1 year to be deemed successful and their charges to be dismissed. Monthly, the team of community partners meets and discusses each case thoroughly. After I finished training law enforcement officers at the end of August, I received 5 referrals. Out of those 5 referrals, 2 of them have remained sober, 1 was terminated due to lack of participation, and 2 are just getting started in their road to recovery. So aside from ILED, I also work in the clinic. Patients may be referred to me from all programs at Panhandle, including our rural counties. Aside from referrals, I created a social determinants of health form that is sent out in the intake paperwork to patients before their appointment. If anything is marked yes on that form, nurse practitioners will refer the patient to me. Such things include, but are not limited to, do you feel safe at home within the past 12 months? Did you worry that your food may run out? Do you need support in making changes in your drinking habits, etc.? Here's a list of things that I can connect patients to in the community. Emergency shelter, access to health care, food and clothing, developmental disability services, employment assistance, housing, mental health counseling, medication management, substance use treatment, legal assistance, medical supplies, insurance navigation, and domestic violence support. I spent a lot of time when I first started here building relationships in the community to ensure these patients could receive these resources in a timely manner. After building those relationships, I started seeing patients toward the end of July, early August. Since then, I've helped a total of 150 patients as of last week. 40% of those patients were counseling, 16% were substance use treatment, 11% were insurance, 10% was med management and psychiatric care, 5% were domestic violence, 3% were developmental disability services, and 8% were housing and clothing and food. So in a typical work week, I'm meeting with anywhere from 12 to 15 people. I'm helping individuals get connected to treatment, making direct referrals into counseling, attending community level meetings such as our regional behavioral health board, being an active member of our sub team, and meeting with law enforcement agencies as well as prosecuting attorneys throughout all 5 northern counties so that access to care in the ILED program can be available in our rural counties as well. The success of this position is not only defined by the number of people we are helping, but the impact we are making in their individual lives. Being able to help people that visit our clinic, our tobacco cessation services, WIC, and Nurse Family Partnership in ways we couldn't help them before is evident in a couple patient testimonials I wanted to share with you. So after connecting these patients to these services, they stated, I have been sober now for 6 months. I was provided with understanding, compassion, and support. This specific individual is an ILED participant of mine and had an injury over 10 years ago. She was prescribed narcotics. The provider stopped her prescription abruptly, and she did not have the resources for other ways to deal with pain management as well as detoxing off the narcotics. She ended up getting addicted to fentanyl, heroin, and meth for years and is doing good now. Another one, this is the longest I've been sober since I was 14. I just hit 148 days. This is the first time treatment has worked. This individual was addicted to fentanyl and released from jail and is currently in an inpatient facility. Another one, I've been on a wait list for 8 months and had lost all hope before I was connected to mental health care. This is something I typically see a lot with the wait lists around here. So I'm happy that the community relationships that I've built have allowed these patients to be seen so quickly. And then my daughter finally feels comfortable with this counselor and things have been running a lot smoother at home for the first time in years. This individual was just getting released from a psychiatric unit down in Boise and is from here. Her parents didn't feel like she was getting the resources that they needed with the person that was helping them. And so I was more than happy to find her a counselor that fit well for her. And then a few more. After sleeping in a car for the past 2 months, a bed never felt so good. I'm finally starting to feel safe again, and counseling helped make it easier in my goal to quit smoking. Because of Panhandle Health District's dedication to improving our community's connection to care, I've built strong relationships with providers, elected officials, law enforcement, and improved our screening process for social determinants of health, and connected a growing list of Panhandle Health District clients to the services that they need. At this time, Mr. Chairman, I can take questions if there are any.
Okay, thank you. Questions, comments, Dr. McClandress?
Just a question regarding those individuals in treatment. It sounded like that was court ordered. No? The first slide.
The first slide, no, there is no court-ordered treatment. Nope. The ILED program is prior to court. So prior to even going to jail, law enforcement will give them the opportunity to work off their charge essentially and get into treatment. If it fails, then there will be court.
Thanks.
Any other comments? Any of you folks over here? So, tell us, Dawn, did I get the idea that this lady is the first person in this particular capacity with the health district?
That is correct, Mr. Chairman.
How did it come about that we started doing this?
Well, I could attempt to answer that question, but I'm going to turn that back to Tegan, and I think Kim could fill in any slots that she might leave out.
Okay, I want to know why and how this whole program got started.
I think a lot of it had to do with the community health assessment and the need for connecting community to care. And so there was parts of different grants that we had already had, and there was deliverables within those grants that I could split between my job and provide all of those missing elements.
Okay, Kim, what would you like to add to that?
Actually, Mr. Chairman, she stated it correctly with our family planning grant, and you can probably speak to that too, Jenna, but the family planning grant allowed us to connect people to care through that grant. There's deliverables of creating referrals, and so that's what played into it. So we had funding to be able to do that, and actually Tina Giraduzzi had looked into it, and she was able to find a way to make that happen. And so just doing our research, and here's Tegan.
All right, Dr. McClandress?
I just comment that living in our world, we don't really recognize what's happening in our community. The mental health crisis is huge. We see dozens in our residency clinic. We see dozens of patients. If we see 100 or 120 patients, we see 30 to 40% who are stabilized by relationship they have with our clinicians. Same is what you're doing. You're engaging with people who have no connection. That's why all those comments, people have had no connection with a therapist or a system that will help them be grounded. And, it's a crisis. It's beyond words. So I'm so happy that we can be, part of that as a public health community as well. Yeah.
Yes, Don?
I think something that was real important that Tegan said to us a minute ago is that in the health district, we don't just follow the money, we follow the need. And that's why every 5 years, we do a community health assessment followed by a community health improvement plan. And that CHA is what led us to actually looking for programs like this. And part of the big issue was access, as Tegan so eloquently described early on in her remarks.
Okay. Yes.
And Mr. Chairman, I would just add, we have just as Dr. McClandress said, there is a tremendous need for mental health in our communities. And what our patients were hearing prior to Tegan starting is that there's a 6-month wait list to even be seen by a counselor or a mental health professional. So when Tegan started here and established her relationships with community partners and are able to funnel people into treatment rapidly, it's made a tremendous difference for our patients.
Yes, go
The
ahead.
turnaround for counseling right now is typically like 48 hours that I can get them to see somebody, so it's pretty awesome.
Okay, let's think about tomorrow and down the road a ways. What's the future for this program? Do you see it growing? Will we need more people working in this, and where will the funds?
Yes, good question. Yes, definitely there's a need for it. Some of our opioid settlement funds will also help fund that going forward and be sustainable. So Tegan and team are working really hard in expansion, especially the ILED program. So that's where it's going to be sustainable for sure. I see it definitely expanding.
Okay. Here's a question, and I may be way out of line here, but do you get involved at all with people who have verbally threatened suicide or anything in that nature?
And so far, since I've been here,
I hear the word crisis, and there's crisis in everywhere you look. There could be a crisis.
I haven't, I've come across with people who have attempted in the past, but I haven't had anybody like verbally say something like that to me since I started here. I've worked with individuals like that prior to working here. That did.
Okay, any other comments, questions? Appreciate your presentation. It's situations out there just are above and beyond our imagination where people need help.
Well, thank you so much for your time, Mr. Chairman.
Well, thank you for coming, and you're welcome anytime.
Thank you.
Well, next on the agenda was a report from Glenn Bailey, but I don't know that Glenn has been able to join us. And I'm not sure he had a whole lot to report, but I wanted to give him the opportunity to bring us up to date if he were available. So it looks like we'll have to postpone anything he has to share with us to our March meeting. So, Christine, that just leaves you.
Mr. Chairman, that came quickly.
Yes. But we know you well enough. Quickly or not quickly, you are prepared.
Let's hope so. Thank you.
Go to the share button, go to the Zoom, yeah. And go up to the meeting, all right. That one.
Oh.
Click on it, and then move the mouse. There's a share button at the bottom.
Oh, there it is. Thank you.
You're welcome.
We will start with our cash history. We're reporting for the 6 months ending December December 31st, our ending cash balance was $5,572,600. That was 5.56 months in reserves. We need to keep in mind, in this balance, we have the opioid funds, which has increased that months in reserves. We'll see how that affects us down here when we adjust for board committed funds of $671,000 and program restricted funds of $1,791,000. The opioid funds of $1.3 million are included in the program restricted funds. Once we back out the board committed funds, program restricted funds, our months in reserves are 3.11 months. If we look at our budget to actual, we are over budget in total revenue by $1,039,000. Again, that's related to the opioid funds. If you read your board report that was sent out by Danielle, I had listed some variances by both fees and contracts. Environmental was under budget by $37,000. That's mainly related, we believe, to the early onset of winter, to where they couldn't get out and work on septic permits, the septic permits. And also we received some funds in January for the food permit fees. And food permits went out a little later this fiscal year than in the prior year. Home health was under budget by $379,000. Health services under budget by $21,530. The story stays the same as what was previously verbalized in other meetings due to low staffing. The COVID and flu vaccines are down, and low visit counts. Vital stats, the death certificate processing was also down. It's down about 16% compared to prior year. And when I looked at the timing between July through September, you could see that the death certificates processed decreased in September when the new fee went into effect. So when we look at personnel expenditures, we're under budget by $300,000. Total operating expense under budget by $220,000. Capital under budget $42,000. Trustee payments over budget by $56,000. And this was, as previously mentioned in another board meeting, that one's difficult to target, but what is creating the over budget in that is a deliverable related to the HRSA grant. And that was not previously budgeted because it was not anticipated when we went into the budget season. Keep in mind, when we develop the budget, we're doing that so early in the season before we get a number of these contracts that we don't know what the funding is and we don't know what the deliverables are in some of those contracts. So in total, we have an excess of $1,532,000 once we adjust for our accounts receivable of $104,830,000. Add that back to our cash beginning balance, it brings us back to the ending cash balance of $5,572,000. Remember that we're cash basis, so that's why we go through this adjustment, adjusting for the change in accounts receivable. Any questions?
Dr. McClendon.
Just one question going back to or under cash accounts in the early presentation. I was just curious about the JEPA, which is our investment accounts, which are listed at $4.9 million. That's where we hold money that we have but hasn't been spent yet, right?
Correct.
Yes, and so how is it held when you name it investment accounts? Who controls that? And,
It's in the state investment pool,
okay,
the local government investment pool.
good.
And it earns interest, and they invest the money and in turn allocate interest to us.
They're basically cash accounts. They're not equities or bonds.
Correct.
Right.
Correct. We
Yeah.
can pull that money, transfer that money between accounts at any time. And what's interesting on that is when we did the budget, the interest rate was 0.2261%. I budgeted at 0.441%, and the November statement was at 2.82% interest.
Thanks.
Does that money that's in that investment account, that's at the state, right?
State Treasurer's Office.
Correct. Does that ever get mixed up at all with Percy funds?
No.
Does,
No.
absolutely not.
No. Absolutely not. Completely, entirely separate. We don't even see Percy-related funds listed on the state treasurer's site. Completely separate.
Okay. Well, that's wonderful. You know, if either fund ever got in trouble, you wouldn't want them mixed up.
No.
Any other questions or comments for Christine at this time? I always like this one page about paying down our building debt. We're as I see this, we're a little bit over 2 years away from having this building paid off.
A little less than 2 years.
A little bit less than 2 years.
We'll be seeing what that looks like in the preliminary budget presented in March.
Which, by the way, time marches on. The finance folks are beginning right away at working on the 24 budget.
Monday, we actually had our meeting with the program managers, looking at our templates, and budget season has kicked off. Our most favorite time of the year.
Every 2 or 3 months, we have to deal with an annual budget.
Thank you, Mr. Chairman.
All right, thank you. Thank you indeed. Okay, Mr. Director, we would like to hear from you. We're moving right along today. By the way, if you think that we're on track for a short meeting, somewhat, yes, we are. But following this open meeting, we will be going into executive session to discuss evaluation for our director. So while you may get to go home early, the rest of us will be around a while. Sir, you have the floor.
Thank you, Mr. Chairman. Just to update on a few items for you, we're moving forward with our Idaho Association of District Board meeting in June. And as we've talked about before, that invited to that are all of the Board of Health members around the state, and also all the district directors, and of course, any guests that they might want to bring. Again, that will be held June 8th, 9th, and 10th. The meat of the program will be the 9th and also the 10th, and that will be held at the Hampton Inn at Riverstone. And very soon, we will be sending out a save the date card. I imagine within the next week or two, that'll be sent out to all of you, and of course, all of the Board of Health members and the district directors. There's also some business portion of that meeting, but as well as that, we've reached out to Seth Griggs, who is the executive director of the Idaho Association of Counties to come and speak. I spoke to him this morning, and he's planning on being there to talk about how the relationship between counties and public health districts. We also have reached out to the University of Idaho to have one of their professors to come and talk about water quality and quantity in the state of Idaho. Certainly about aquifers and what's happening around the state. Again, not just the quality, but the quantity of water around the state. So that should be a very, very interesting presentation to our Board of Health members. The third topic will be a discussion on opioid use around the state. And those speakers will probably come from District 1. And Kim Young and Kelsey Orlando are assisting us with that. And they will be gathering information from around the state on that topic. So again, June 8th, 9th, and 10th at the Hampton Inn at Riverstone. Speaking of opioid settlement funding, I don't have too much to add on that, as you have approved some additional settlements that we have. And as I mentioned prior, the counties of Shoshone County and Bonner County have allocated their settlement funds to Panhandle Health District, as well as the cities of Post Falls, Coeur d'Alene, and Hayden, making this a significant amount of revenue coming to the health district. It's, again, final numbers haven't come, but it's somewhere in the neighborhood of over $700,000 a year for the next 16 years. That rivals the money that we receive for the Women's, Infants, and Children program from the Department of Agriculture. And Kim and her team have worked actively to make sure we have a clear plan for the use of those funds. And that includes harm reduction. And we're very much involved in Narcan and getting that distributed. It's also treatment, and we're going to be speaking with Kootenai County and also Bonner County to provide treatment in jails, and also prevention. And that will really be a public information about opioid use. And the fourth area, maybe the most interesting, is we are carving out that money for other partners to use that as it relates to opioid use disorder. So it's moving along nicely, but it is an awful lot of funds coming into the health district, and as Christine mentioned in her budget presentation.
They ask,
Please.
what has Kootenai County decided to do with their allocation? Have they defined it?
They have also expressed interest in using it in an incarcerated setting.
Okay.
We are going to, I have a meeting scheduled with them here within the next few weeks, where Kim and I and McKenna, who oversees our funding, we're going to ask them that very question and see if we can't collaborate with Kootenai County. Next on my report, LUMA transition, and I only mention this just informationally to the board, is going to be a change in our financial / HR payroll system. The state is going through that, so by default, we are also, and that is going to be very time consuming over the next few months. Full implementation will not be until the beginning of the fiscal year on July 1, although payroll begins processing with that system on June 11th. So there's a lot of work to be done on that, but that is something I have not experienced here at the Health District. We've been under the current system with the state for many years. We're cautiously optimistic about this transition. Certainly some of the electronic abilities that it has will be improvements on what we have now, but also our ability to report, we hope, will be much improved to what we have right now. So there will be more that we're presenting to you as board members on that going forward. That is a significant change for us. As was mentioned, and I don't need to say much more, we're moving into our FY24 budget season. And as Christine mentioned, we had our first meeting earlier in the week. And again, just a reminder of that process. We put that budget together. We present it to the board, who doesn't approve the budget. They take a look at it and offer suggestions and direction. We then take it to each one of our county commissioners, and that'll happen May or June. When does that happen last year?
We present the draft budget in March, present the final budget in April, get the go-ahead from the board, and then after the April meeting, we go out to the counties.
And again, when we go, thank you, Christine. Again, when we go out to the counties, we aren't getting an approval. And your approval as a board is just allowing us to present that. The final approval will happen right around the beginning of the fiscal year when we invite the chairman of each one of the county commissioners to come to this meeting, and they officially vote on that budget going forward. So a lot's happening here in the next few months. And finally, I wanted to share, and thank you, Mr. Chairman, for letting me present this to you. I had one of the most delightful experiences I've had at the Health District. This marvelous group you see in front of you direct the Veterans Outreach Center in St. Mary's, Idaho. And they do a tremendous amount of work. You'll see on my right there a gentleman by the name of Hank Thornton. Hank is a veteran and has spent a lot of time visiting veterans throughout Benewah County. He personally visits them, particularly those that are dealing with suicidal ideation. As you know, we have our Suicide Prevention Action Network, and every year we have a walk. And we generated enough revenue in our walk last September that we were able to donate $1,000 to this group, to Mr. Thornton and his group, to purchase this building that they have in St. Mary's. They now have a Veterans Outreach Center. In 38 days of it being opened, over 550 veterans came through that facility for support, to be fed, and maybe more important, the socialization that they get at that facility. So again, I'm just so pleased that we were able to have that fundraiser, generate those funds, and then use it for an extremely worthwhile need in the area of Benewah County. So that's my report, Mr. Chairman.
Any questions or comments for our director now? Here's your chance to speak with him if you like. Hearing none, we will move on. And like I mentioned to you a moment ago, this meeting will seem short to you, but we have other business to attend to at this time. So the next item on our agenda, I will entertain a motion that we go into executive session for the purpose of evaluation of a staff member based on Idaho Code 74-206 sub B. And we will have a motion. We will then have a roll call vote from the board members. And then we'll make sure that we have the mechanics taken care of. So we have a PA system. We can still talk with Tim, but we won't put this over public YouTube or whatever it is. So I will entertain that motion at this time.
Mr. Chairman, I'd move to executive session following Article Code 74-206B for purpose of evaluation of staff member.
All right, is there a second to the motion?
I'll second that motion.
Thank you. It has been moved and seconded. We will call now for a roll call vote. Tim, can you hear me?
Yes, I can hear you.
And your vote is?
Yes.
And Dr. McClandris?
Yes.
Yes.
Yes. All right, my vote is yes. So now we are in executive session. Thank you for being here. And for those of you who presented to